In my practice and in my clinical trials, we stress this is a family intervention. And so I want people to adopt health behavior change that the family can adopt. So if the family is like, there's no way I can do a paleo diet, but I could do a Mediterranean diet. I'm like, okay, do the Mediterranean diet. Or there's no way I'm going to feel good about doing a paleo diet, but I feel okay about doing a low-fat swank diet. Like, okay, let's start there. And then I do have people who's like, I am so ill. I'm so worried about the future. I want the most potent interventions you've got. And my family's behind me. We're going to do this all together. And so then we'll talk about what that might look like. It's super important to listen deeply to the patient and the family. It's vital that you help them choose intervention they can be successful at.
This is the Visible Voices podcast. I'm your host, Dr. Resa E. Lewis. In today's episode, I speak with Dr. Terry Wahls. Terry is a clinical professor of medicine at the University of Iowa, a medical educator, patient advocate, and researcher. She's a fifth-generation Iowan who grew up on a farm. In 2000, she became a patient. She was diagnosed with relapsing remitting MS, that's multiple sclerosis, which progressed to secondary progressive MS. In 2007, her condition deteriorated to the point that she required a tilt-recline wheelchair. That same year, she began a journey in human-centered design. And yes, audience, she herself was at the center of her own healthcare design. Terry redesigned her diet using the medical literature, or as I like to say, the literature, functional medicine, and her knowledge of the hunter-gatherer diet to develop what would become the Wahls Protocol. Within a year, she regained mobility, including riding a bicycle and walking without a cane. She now regularly runs on a treadmill, and you can see that on Instagram. Terry is the author of a 2020 book originally published in 2014, The Wahls Protocol, a radical new way to treat all chronic autoimmune conditions using Paleo principles. Terry came on my radar through a good emergency medicine physician friend. We tend to chat about our own lifestyle behaviors and food choices. He told me about Dr. Terry Wahls, about her book, and how her protocol changed the life of someone he knows very well. I was super curious. Audience, a brief background on MS, multiple sclerosis. This is a complex immune-mediated neurodegenerative disease that affects an estimated 2.8 million people worldwide. The onset is believed to result from interactions between genetics, epigenetics, and environmental factors. Over the past few decades, there's been an increase in the incidence of MS, suggesting significant changes in environmental risk factors associated with the development of the disease. In MS, the body's immune system attacks the protective covering of nerve fibers, that's called myelin, disrupting communication between the brain and the rest of the body. I want to start our conversation focusing on you. How old are you?
I am 69, soon to be 70.
And how old do you feel?
Well, I do these biomarker assessments, telomeres, and the telomeres tell me that by telomeres, I'm 15 years younger than my stated age. So my biologic age, quite a bit younger. I can do 12 push-ups. I can jog. I can carry 50 pounds, 2 minutes. I can carry 30 pounds climbing stairs. And every time I see my neurologist, I'm doing push-ups and we're seeing how long I can stand on one leg. And they keep saying, you just keep getting better each year that I'm seeing you.
What fixed symptoms do you live with today?
None.
None.
The fixed symptoms I have worsening pain in my right hip. I have some severe osteoarthritis there. And keep in mind, my dad had severe osteoarthritis, had his hip replaced in his early 60s. My brothers likewise have had their hips replaced in their early 60s. So my physicians have suggested I do a hip replacement. I'm like, no, I think I'm doing physical therapy. We'll do physical medicine rehab. There are a number of things that I can do to put that off for a while yet.
For the audience that may not be familiar with the Wahls Protocol, let's start with actually looking at the differences between the Wahls Protocol and the standard paleo diet.
I had the theory that mitochondrial dysfunction drove disability. So I'd created a supplement cocktail for my mitochondria. Discovered Institute for Functional Medicine had a longer list of supplements, again, all for my mitochondria. Then I had this big aha, and I laugh now, Resa, how long it took to have this aha. Like, what if I redesigned my paleo diet based on this long list of nutrients that identified as really important to mitochondria health and to brain health? So that was a few more months of research to figure out where those nutrients were in the food supply of a paleo diet. So I started eating that way. It was really quite striking. Within a month, my fatigue was definitely reduced. My pain was greatly reduced. My mental clarity was improving. And my physical therapist said, Terry, you are getting stronger. And he was advancing my exercise. And that is super interesting. So I combined what we've known evolutionarily, the foods that we have been eating. And of course, there are many different versions of the paleo diet because there are many ecosystems all around the world. What I did was, okay, given the foods that I can access, how would I have the great supply of all the nutrients that science says my brain needs to rebuild itself? And of course, I'm like, how long is it going to take? It might take a couple of years. It's probably about 7 years to rebuild all the molecules in your brain, 20 years to rebuild the molecules in your skeleton. But I went from being unable to sit up to walking without a cane in about 3 months, and to biking around the block in 6 months. And then a year, well, actually 9 months to a year, biking 18.5 miles. Now, I should be clear that diet's part of it, meditation is part of it, exercise is part of it, intensive physical therapy, and is also doing electrical stimulation of muscles, something that athletes have been doing for decades, very intensively with a physical therapist who treats athletes. And I am a former athlete, so I really understood and was committed to an athletic approach to training.
The connection between mitochondria, myelin, and why this actually helps brain and helped you.
So there's increasing awareness that for some people, we can't use our sugar very well in the brain. It becomes less and less effective. So the brain is starving for energy. But in those same people, most of them can still use ketone bodies or fats, which is why for people with seizures, with cognitive decline, we've known for a long time that a ketogenic diet can be very helpful for those individuals. We're now having more research that ketogenic diets can be very helpful for people who are overweight, obese, type 2 diabetes, people who are being treated for cancer. And there's certainly emerging evidence that people with really severe psychiatric problems, severe anxiety, severe depression, bipolar, psychoses, delusions, hallucinations, they've done remarkably better on a ketogenic diet.
You mentioned 9 cups, and audience, again, who are encountering the Wahls Protocol, like, wait a minute, what, 9 cups? Like 3 cups of leafy greens, 3 cups of deeply colored vegetables and fruits, 3 cups of sulfur-rich vegetables. But this goes back to the behavior change. And I've heard you chat about what you have seen make behavior change stick. And I'm wondering if you can chat about that, because you've really worked with a lot of people who have had sustainable behavior change.
We've been very, very successful, and a reason to do the work, because biologically, our brains are wired to seek pleasure and avoid pain and discomfort. So unless there's a reason to endure that, you're not going to endure the discomfort of giving up sugar, giving up addictive foods, sedentary behavior. You won't endure the pain of doing a workout with inconvenience.
How easy or difficult is it for people to have this behavior change if they're doing it solo versus having the whole family on board?
In my practice and in my clinical trials, we stress this is a family intervention. And so I want people to adopt health behavior change that the family can adopt. So if the family is like, there's no way I can do a paleo diet, but I could do a Mediterranean diet. I'm like, okay, do the Mediterranean diet. Or there's no way I'm going to feel good about doing a paleo diet, but I feel okay about doing a low-fat swank diet. Like, okay, let's start there. And then I do have people who's like, I am so ill. I'm so worried about the future. I want the most potent interventions you've got. And my family's behind me. We're going to do this all together. And so then we'll talk about what that might look like. It's super important to listen deeply to the patient and the family. It's vital that you help them choose intervention they can be successful at. Sometimes I have people want to have a great big intervention. And I have to say, okay, we can have a lot of components, but we're going to help you bite size what we're going to do so you can have one success, then the next success, then the next success.
It's graduation season, and guess what? There's a perfect gift for anyone taking their next big step. It's called Microskills, Small Actions, Big Impact, co-authored by Dr. Resa E. Lewis. This book breaks down success into specific intentional behaviors that anyone can develop, whether you're a student entering the workforce or simply wanting to improve your daily interactions, and who wouldn't want to do that? These evidence-based techniques will transform how you communicate and present yourself. What makes this book so special is that it doesn't offer generic advice. It provides actionable resources that make a real difference in all aspects of your life. Available in hardcover, ebook, and audiobook formats wherever you get your books. And if you're looking to bring microskills to your organization or student group, reach out to Dr. Lewis directly via LinkedIn or through her website. Remember, microskills, your go-to graduation gift that keeps on giving throughout life's journey.
In 2011, your TEDx talk called Minding Your Mitochondria. I saw in the comments something about the MS Society, and then you posted actually on Instagram, I did not see any of this coming. Not my recovery, not the change in my clinical practice, not the resistance from dietitians and medical colleagues. Nor did I anticipate becoming a banned speaker for creating false hope like the National MS Society. However, now they've actually given you a $1.5 million grant to pursue your work through clinical trials and such. Is that right?
Yeah. And what happened is the public drove this. I was banned in 2009. My ideas were really radical. I wasn't saying don't take drugs. I was saying you got to fix your diet and lifestyle and work with your neurologist. I'm not a neurologist. So I learned to be much more clear that I'm not anti-drug. I treat my disease very, very aggressively. I realize people have to read and make their own decision about the risks that they want to take. But I want everyone to work on diet and lifestyle. So I just went about my life, spoke where I was invited, did my research, published our findings, presented our findings, slowly got into higher impact journals, did the TED Talk. The public response to the TED Talk was big enough that I got my book deal. My book came out in 2014. And because the MS Society monitors social media, they saw this explosion of social media mentions about diet, about the Paleo diet, about the Wahls Protocol, about Dr. Terry Wahls, that completely swamped all the conversations about the new highly effective DMTs. And their donors said, we want a wellness conference and we want to talk about your research priorities. So they tracked me down, got me on the phone, wanted me to come. By the way, I was a plenary speaker at another conference the day they wanted me to speak. So I said, well, we have a couple of things. I'm a plenary speaker at another conference. I can see if I can get that moved to a different day. However, I'm a banned speaker by you guys. And so for me to come, and I'm open to it if I can get in writing that I'm no longer banned. It took them 20 minutes. Fortunately, the other event agreed to change the day that I spoke. And so I was able to attend both.
You've just illustrated how you have evolved and become even more of a visible voice. When did you realize you had a voice, and when did you start using that voice?
One of the things I've understood in life is there's always going to be terrible challenges in our life, but we can choose how we respond. We can choose growth. It may feel overwhelming, but I'll just do the next small thing that I can do to support what I think needs to happen, either in my life or in my community and my worldview. And at various times throughout my medical training and medical practice, some of my other colleagues, they had a very different view. They felt like they had no control over the events. I'm like, no, we always have control. We always have control. And even when things were going relentlessly downhill, and they did that for 27 years in my life. I had young kids, and I knew that my young children, who were 5 and 8, and then 8 and 11, et cetera, they were watching what I was doing. And I could either piss and moan and woe is me, or I could get up and do my little physical therapy every day and be reading and thinking and making what little choices I could to slow my decline as well as I could. And now my two children are 33 and 30, and they talk about how they really understand that, yep, terrible things can happen, but there are always things that you can do to make your circumstances a little bit better. And you may be quite surprised that each little bit better may lead to a whole lot better for your health, for your community, for your worldview.
We have choice. At one point, you were very strongly advocating like coconut oil. And now I've heard you speak a little bit more about olive oil. I'm wondering if you could clarify where you stand on that.
A medium chain triglyceride generates more ketones than the other fats. And so a medium chain triglyceride ketogenic diet is easier to follow. But some individuals will have a elevation of their lipid profile. So what I'd like to do is check baseline lipids. We look at the cardiovascular risk factors. Is there a family history of dementia, APOE4? In those circumstances, I really want them to use an olive oil-based ketogenic diet. If they want to try a medium chain triglyceride ketogenic diet, they can. And whatever ketogenic diet you do, you really need to follow lipids closely to see how that person responds.
I shared in the intro that my friend told me about you, about the protocol, about the book, and he has someone close to him who has MS. So I spoke with this friend, and I was so glad that they were welcoming of me, and they verified that they found the Wahls Protocol, and it completely reversed their symptoms of MS, and they live by it. And when they sort of knowingly cheat, like a piece of cake, all of a sudden they just develop horrible fatigue.
Mm-hmm.
And they also had symptoms of trigeminal neuralgia. And so those triggers, the sensitivity of the food and staying on the diet seems quite pronounced.
When people enroll in our studies and when they enroll in my clinical practice or in any of the programs that we have online, we talk about paying attention to what I call biosensors. And so if you have pain, that's super helpful because biologically we want to avoid pain. If you can't see because you have flare of optic neuritis, that's also very helpful because vision is so important to us. If you have a motor problem, that's helpful. Fatigue, generally people will respond to. So we try to have people pay attention to what are your biosensors. And when you experience a flare of your biosensor symptom, look back to your previous 24 hours and have theories as to what the trigger was. And you may discover there was a food trigger or a stress trigger or wildfire. There's a lot of wildfires, a local air pollution problem, and a virus. So if I get some viruses, that will trigger my trigeminal neuralgia. If I come to your house, Resa, and you don't do a good job of reading the ingredients labels, you might accidentally give me gluten, dairy, or eggs. So eating at friends makes me very nervous. I have a big conversation. I'll bring food along because I've had people accidentally give me foods that are a problem. But if people can get tuned into their biosensor and then have a thoughtful conversation between themselves and their family, okay, I had a flare of my symptom. What do you think might have been the trigger? And over time, people can get smarter and smarter. In our studies, very consistently, the people who've been the most successful are those who have a biosensor. And they're like, I have an indiscretion. I feel terrible. So, I decided those indiscretions just were not worth it anymore. And the people who don't have a biosensor tend to drift away.
You and I both know that those biosensors can be heightened. We can become even more aware with paying attention to some of the other behavioral changes, sleep, meditation, yoga, being in nature, all these things that heighten our awareness of ourselves.
Absolutely. Teaching people mindfulness can be very, very helpful.
When I was young, elementary school, we in my household were not allowed to leave the house without taking 2 vitamins. One was Triviflor, which the pediatrician prescribed because it was a fluoride vitamin. The other was a cod liver oil pill. And this is something that my mom swore by because she said that it would help prevent us from getting sick. Discuss.
I think it's really helpful if you have a little vitamin D boost. So if you have a little higher vitamin D, you'll have more of the antimicrobial peptide. And so that will protect you from your first exposure to a virus or a bacteria a little more effectively. A multivitamin, certainly now, as we have more and more ultra processed foods, we have more nutrient insufficiencies. So I think a multivitamin, multimineral can be very helpful. So cod liver oil, yes, because it gave you extra vitamin D and it gave you more omega-3s. And when I was an infant, my mama told me that you put cod liver oil in the bottle, and that was a standard recommendation, which was fabulously good for my brain. So I'm super glad that my mama did that.
I'm wondering if you can clarify for those that are living with long COVID or were infected and are concerned about developing it, what would you suggest in terms of behavioral and dietary modifications?
The first thing, the people living with long COVID, please go to terrywalls.com/trials and register for my long COVID study. We have a long COVID study. It's a virtual intervention. And so there be some opportunities for you there. Again, the long COVID individual, you have your innate immune system sort of stuck on, and the resolution phase has not been turned on. What can we do for these people? Improve nutrition. I think multivitamin, B vitamins, fish oil, vitamin D, great start. Having more protein, more non-starchy vegetables. And it's really important to get rid of the sugar, get rid of the white flour. So we want you to improve your nutrition. And then I would work on sleep, stress reduction, and exercise is going to have to be at a very gradual, incremental plan to increase. When I talk about exercise with my patients, I have patients who range from athletic to wheelchair bound to bed bound. And so when we talk about doing exercise, I talk about high intensity, moderate intensity, low intensity, and you make that decision based on can you talk or sing while you're doing the exercise. If you can sing, that's a like row your boats or any of your wheels go around the bus. If you can sing while you're exercising, that's a low intensity exercise. If you can't sing, but you and I could still be talking, that's moderate intensity. If now I'm working so hard, I can't talk to you, Resa, that's high intensity.
AI. Where is AI playing a role in your work? Mitochondrial health, MS, your clinical trials?
The university does have some guidance on how we use that. So I can use that to help me search for citations and backgrounds. But I want to caution folks, you still have to, when you get your results, know that you can also get trash results. And so check your results. They can let you find things perhaps a little more quickly, but you can still get nonsensical information.
You gave a little bit of a foreshadow of your clinical trials that are ongoing. Can you tell us what you and your teams are working on now?
We have a really marvelous study comparing the ketogenic diet, olive oil based, to a modified paleo elimination diet compared to usual diet. In the usual diet group, we give information about the dietary guidelines, MRIs at baseline, clinical measures, patient reported outcomes, and they'll come back at 3 months for some blood work and clinical measures. And again, at 24 months, we'll repeat the MRI, clinical measures, patient reported outcomes, and we get a bunch of blood and saliva for biomarkers. We have 162 people in. Our primary outcome was 6 months, and we had 158 complete that. That's a 97.5% retention rate, which is extraordinary. And we anticipate getting our last study visit early July of 2026. We'll be cleaning the data, analyzing it later in 2026. In 2027, we will be presenting whatever it is we find at the international MS meetings, and then we will be submitting it for publication in 2028. We have a couple more studies that we are planning, looking at some biomarkers, and can you improve the health of the microbiome with some online applications that we've developed. So we're very excited about that. We have studies ongoing for fibromyalgia, for long COVID. And we also have a patient registry for if you have people with a mental health issue, neurologic issue, psychiatric issue, we want them to sign up for a patient registry so we can include them and notify them about our future clinical trials.
Terry, your legacy.
So I've made it my mission to do the research, to train clinicians, to train the next level of scientists. And I fully anticipate within 30 years, the standard of care will be that we, yes, will offer drugs. At the same time, say it's vital that you also address modifiable lifestyle factors.
The Resa wrap up. Special thanks to Dr. Terry Wahls for joining me in conversation. If you want to follow, listen, learn more, you can go to her website, terrywahls.com. That's TerryWahls.com. You can also follow her on Instagram, Dr. Terry Wahls. Audience, check out her 2011 TED Talk, where she shares her journey from being wheelchair-bound to regaining mobility through the Wahls Protocol, which emphasizes not only dietary changes, but also lifestyle modifications. So you probably get it. Food is medicine, and scientists, physicians, and other researchers are really figuring this all out. So I want you to just do one thing. Think about the food you're eating and the drinks you're drinking. If you can reduce the amount of sugar you're eating, the sugar you're drinking, if you can avoid ultra-processed foods, it is in all likelihood that you will prevent, reverse, and treat chronic diseases such as diabetes, cardiovascular disease, cancer, and obesity. That's all I have for you this week, audience. See you next time. The Visible Voices podcast amplifies voices in the healthcare, equity, and current trends spaces. We are a production of the People's Media Network. Our team includes Dr. Giuliano DePortu and me, Dr. Resa E. Lewis. Please find me through my website and on social media, Resa E. Lewis, MD, or through the podcast, thevisiblevoicespodcast.com. Please give us a 5-star rating on Apple or wherever you listen to podcasts. Also, please be sure to share the show with a friend. The views and opinions expressed by the host and guests are their own and do not necessarily reflect the opinion of the institution with which they are affiliated or identified. Information herein should never be used as a substitute for clinical judgment or for medical advice.